Welcome back to Connect with MOBEC, the video series. Today's topic is 5 things that we want you to know about your diabetes. When I say that, I mean 5 things your healthcare team wants you to know about your diabetes. I'm Shubrook, a professor and diabetologist at Touro University, California. This session was adapted from a Health Grades article that was published a few years ago. So what are the 5 things we want you to know about your diabetes? First, diabetes can be controlled, but not cured at this time. And I think this is really important. Today in the media, we hear a lot about reversing diabetes and curing diabetes. And while we all are very hopeful for this, and we'd love to see this happen, the evidence doesn't really support that right now. It is true that if we get on top of our diabetes, do a substantial behavior change, that includes modification of diet and nutrition and physical activity, and sometimes with medications, we can control the diabetes down to a level where the sugar readings are normal. We would call that in remission if you can do that without the use of any medications. However, it is something that you have to keep up with. Unlike cancer, if you're cured from cancer, you don't have to keep taking treatment. If you're cured from diabetes, you have to continue doing those things that allow you to get control. So I want to help you get control of your diabetes, but also have reasonable expectations for management for this. The second thing, it's never too late to have lifestyle be part of your management. Lifestyle is no matter what type of diabetes you have, lifestyle is a central part of that management, including healthy eating, physical activity, getting good rest, stress reduction, and just staying healthy. Those things are all part of managing diabetes. And the more that you're able to engage in these things, the less we have to use medications and other interventions for your diabetes. And no matter what type of diabetes and no matter what stage you're at, even if you have complications, lifestyle still has an important part. And unlike medications, for most of them, the lifestyle changes you do not only help your diabetes, they help your heart, they help your breathing, they help your muscles. So really, lifestyle change is a treatment for all conditions. The next is that no symptoms does not mean that your diabetes is mild. And this is really important. I see this quite regularly. Many people will say, well, I don't feel it, so I must not have diabetes. Most people are diagnosed with diabetes because of a routine blood test or during a physical, not because they have specific symptoms. Those symptoms actually come very late in the disease. So it is very important that if you are at risk for diabetes or someone in your family is at risk, please go get screened, because screening is the one way you can find this disease early. And then if you have diabetes, the same is true for complications. There is no telltale sign for complications for your feet, for your eyes, and for your kidneys, and even for your heart. The most common symptom is none at first. And so that's why it's so critical to get your dilated eye exam. Make sure you get a blood test checking your kidney function and for protein in the urine, and that you look at your feet every day and your healthcare team looks at your feet every visit to make sure you're not developing these complications. The earlier you can find these, the easier they are to treat, and they're largely controllable. Next, insulin is not failure. Most people with diabetes, regardless of the type of diabetes they have, are going to need insulin at some point in their life. So while lots of people are worried about insulin, they're maybe worried about side effects, it is a necessary part of the treatment of diabetes. And we have found that the earlier you use it and the more purposefully you use it, the better it works and the less likely that you need to stay on it. I also want you to know that we have many, many patients who start insulin, but then also stop it and get off. So if we wait and wait and wait to start insulin until the disease has progressed so greatly, then it feels like a failure because you've gone through all these other treatments. Using it early on, using it when you need it, let's say getting ready for a surgery, or if you've had steroids for some condition you had and you need insulin to cover, allows this the most powerful medicine for diabetes to be used in a time-limited manner. So insulin is not failure. Diabetes is progressive and many people will need insulin. And once you're on insulin, it doesn't mean you're on insulin forever if you're using it in a way that makes sense and is smart. And then the last thing is it takes a team to manage your diabetes. We know how complicated diabetes is. We know how much work it takes to do all the behavior change necessary to manage your diabetes. So don't take that by yourself. You don't need to go it alone. Rely on your healthcare team. That could include your primary care provider, your diabetes specialist, a diabetes educator, dietitian, even maybe a health coach. Also, don't be shy about letting your healthcare team help you. So the more touch points you have, the more we can share and help you take on that responsibility. And then let your family and community members be involved as well. As you know, diabetes is a condition that runs through, particularly type 2, through families very strongly. And so it's going to affect all your family. And the more your family is involved early, the less burden it's going to be on your family in the long run. So please know it takes a team to manage diabetes, and you can do it with your team. We hope this has been helpful for you. It's very important for us to make sure that we're in touch and we're providing you resources that you need. Please visit our social media sites, Facebook, Twitter, and Instagram, and you'll have an opportunity to leave questions in response to this, and we'll have weekly sessions to respond and make sure that we're answering your questions. Thank you so much, and have a great day.